Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning are two nurse navigators with Covenant Cancer Care Center, Angela Bradley and Ann Worley. Thank you so much for being here, ladies. We appreciate it. How are you?
Great, thank you.
Excellent. You know, before we get into it, before we dig into this, I want to ask, what is a nurse navigator? Either one of you can take it, please.
A nurse navigator is almost like a patient advocate,
Okay.
a hand holder, an educator for a patient who is going through a workup for cancer or who currently has been diagnosed with cancer. We help them through the process, help them to understand what's happening, what comes next. We can help them get appointments. We work with agencies to get them rides. We point them in the right direction for financial assistance or help with their insurance. We make the unthinkable, ununderstandable, understandable.
I love it. You know what? I'm just going to say you're like little angels here on earth. We definitely need you. Thank you so much for explaining that to us. Now, you work at the Covenant Cancer Care Center, and one of your missions is to help people get cancer screenings for prevention. So tell us a little bit about that. Why is that so important right now?
Well, early detection is key for patients with cancer. The quicker that we can, and earlier that we can diagnose patients, the more effective the treatments will be, and we can get them through and hopefully cured.
Yeah, of course. And there are two screenings that you would like to educate people on today. And can you tell us a little bit about lung cancer screenings? Who should get them and what people should know about those screenings?
Well, who should get them first? There's a high-risk group that has been identified. Currently, it's people 55 to 77 who used to smoke cigarettes or who have quit within the last 15 years or who currently smoke cigarettes. And these are people who've approximately smoked about a pack a day for 30 years.
Okay.
These people have a higher risk for lung cancer.
Right.
And there is a low-dose CT, which is a CAT scan of the lungs. It's very quick, very easy. You get a very low dose of radiation with it, and it's a yearly screening. And these people then come back year after year, and the hope is that if a lung cancer starts to develop, we can find it at a very early stage. Stage 1 lung cancer, the treatments are surgery versus a type of radiation called SBRT, and it's much more curable than the other stages of lung cancer. And so we want to get people in there early.
That's right. And I always tell people a cancer diagnosis is not a death sentence anymore, not at all. That's why early detection and prevention is key. Now, Angela, tell us about colorectal cancer. It's one of the leading causes of cancer deaths, but the good news is that it's also one of the most preventable cancers thanks to advanced screening options. Can you tell us a little bit about those screening options?
Yes, there are several different types of colorectal cancer screening options for patients.
Yes.
I always encourage people to talk to their physician about what's best for them, but there are actual tests that patients can do at home with obtaining a stool sample and sending it into the lab to see if there's any blood or DNA changes. So usually those are done about yearly. In addition to that, patients can also have scopes done. They can have a flexible sigmoidoscopy, which are usually done about every 5 years, and that checks the lower portion of the colon where most of the time polyps can form. Or there's a full colonoscopy that looks at the whole colon, and the advantage of that is they don't have to be done as often, and doctors can actually find polyps, which can eventually turn into cancerous lesions, and they can remove them, which is basically preventing cancer before it even starts. It's always been at age 50 where patients are encouraged to start. It's just been recently changed back to 45 because unfortunately we're seeing younger patients being diagnosed with colorectal cancers. So I encourage patients to talk to their physician about what's best for them, and the best screening option for you is the one that you'll follow through with.
I love that. Screening is so important. Now, if someone has questions about screenings, who should they contact?
They can call the Covenant Cancer Care Center at 989-583-5060, or Angie or myself at 583-5014 or 5118. Any of us can answer questions on many of our flyers and on our website. If you go to www.covenanthealthcare.com, you can find a tab about cancer screenings, and our numbers are also there.
That's great. You have given us such valuable information today. Angela, and anything that you'd like to add that we have not covered that's important for folks to know?
Well, number one, if you're a smoker, please quit. Smoking is a very big risk factor for any type of cancer, and it's one we certainly can modify. While we know it's not easy to quit, that old standby saying, never quit quitting, is true. Keep trying. We know it's tough, but it's so important.
Yes, and prevention is key. There are lifestyle risk factors that we can do at home for ourselves. And smoking actually has been linked to 13 different types of cancer, not just lung cancer, and colorectal is one of them. So quitting smoking is very important. Limiting your alcohol intake or quitting drinking altogether. Healthy lifestyle with a healthy diet, rich in vegetables and fruits and low in processed and red meat. Exercise, maintaining a healthy weight are very, very important.
Oh, great tips, great information there. If you're smoking, quit and do not start, and eat your fruits and veggies. And prevention's key. Thank you both for joining us this morning with this valuable information. We appreciate it. We're delighted to have you here.
Thank you, Colette.
Of course, you are so welcome. If you'd like any additional information on today's topic, just head on over to the Hot Links page. That's on WNEM.com.